Well, today we're here, Ginny and myself, talking about public health, and it's something that's big, and you hear that word all the time, public health. But what is public health?
Well, public health is really very simply just the health of our local communities across the nation, and we try to improve that through education, research, and public policy changes.
So why public health? What do we even do with it? Why do we have it?
Well, the best way to describe what public health is through examples, and some of the ones most recently that we have seen that people will realize have affected their lifestyle are the development of seat belts for automobiles, the addition of fluoride to our public drinking water, which has really reduced dental cavities in especially small children. Even the improvements in maternal and child health. Most mothers receive very good health care these days and have healthy babies thanks to public health.
So here we've talked about public health and what it is, but what's the difference between public health and individual health?
Well, public health is really looking at groups of populations, and we're focusing on prevention before something happens or try to prevent something from reoccurring. And individual health is really on treatment of an individual, where you would go to a doctor and receive treatment for a disease or a condition that you already have.
Mm-hmm. So with all of the issues out there that you talked about earlier, like seat belts and fluoride in water and things like that, how do we even decide to work on certain issues?
Well, that comes about through really the core of public health, which is data. And we collect data or numbers, and that's how we base all of our decisions. We know what kind of an impact that public health can have, where we can make our improvements and prevent certain things from happening.
How is data collected?
Well, we collect really population statistics, and we're collecting large amounts of numbers so we can really see the big picture. It's not looking at small things, where if you're at an individual level, you'd be looking at blood pressures or those types of things. This is really big picture stuff. So we can see trends across populations. We can see what factors are influencing them from the environment or other lifestyle habits.
So can you give me an example of what kind of data have been collected, like nationwide? Are there any examples of that?
Well, probably one of the most basic data that we have started collecting a long time ago is just what we call our vital statistics, simple birth and death records. That really started influencing public health. We started to see trends. What were people dying from, and how many children were being born in different populations? And so that gave us a good idea of really, really basic data.
So once you have this data, then you use it to make public health decisions. Is that right?
Yeah, and those numbers will influence public policy changes at the government level, at local, county, and even state or national level. And that's how we influence things with our data.
Well, that sounds really important, and it sounds like the data that we collect is very vital to our public health.
It is, and there's different instruments for collecting data. These can be simple surveys or more complex instruments needed to collect specific types of data, but our data is really only as good as our instruments that we use to collect it and the humans that collect the data. And so we really want things that are accurate and reliable, so that we know that we're making sound decisions.
Is there anything we should be leery of when we look at data?
Well, there are lots of things that influence it, and you should always approach it with a skeptical mind and be questioning who's collecting it, where it's coming from, and making sure that it's good quality data. Things always influence it. There's different biases that can influence data, and so you have to take that into account.
Well, thanks again, Ginny, for coming and talking about public health and data. These are two really important issues to us.
You're welcome.